and this is Life with Jason Clemmons, DC. It is Thursday, March the 7th, and we are live right here from the Rock Health and Wellness Center studios in Lubbock, Texas, and on 98.7 Walk by Faith and 1420 AM Lubbock Christian Nation Radio right here in West Texas as well. So hope you guys have had a fantastic day. Hope everything went your way. It's been beautiful out here. Another beautiful day in West Texas. It's like 3 or 4 in a row. We must be living right out here. So it's been really nice, beautiful weather. I've been in the building most of the day, but I can look out the windows. The one thing about our new building that we got here back in 2021 is we've got a lot of windows. So it's good to be able to look outside and see the beautiful weather that's going on. People are back out at it, and there's good things happening. You know, I tell people all the time in the wintertime, just hang on till March. Just hang on till March. We'll get you back around to March, and then things will start getting better for your health. And we're really seeing it. People have a chance to get outside. They have a chance to go for a walk, get on their feet, get their nervous system functioning properly, get their body moving like they're supposed to. And that really does give us a good shot at improving our health, right? So we've had some good shows this week. We had a good Take Health to Church on Monday, talking about the next person and how our relationship with God and is really the single thing that we ought to do to keep ourselves in line with the way things go. And we talked about it was a really revealing story for me, sermon for me on Sunday, just to say, hey, you know what? Same thing happens when we get ourselves straight with our nutrition. We get ourselves straight with our exercise. We get ourselves straight with the way our body functions. We just don't get tempted like a lot of us have for so long. So I highly encourage you to go back on Monday, watch that show if you haven't seen it. If you guys are on the radio and you want to re-listen to that Monday show, catch us on Facebook, YouTube, or X, and we'll be able to you could go back and check out any of those shows anytime, but those are there for you. And that was a good one on Monday. And then Tuesday and Wednesday, we just got into different kind of thoughts, some different things to talk about. Tuesday, I went over my blood work. Last night, we just talked about health and had some different thoughts, had some different articles for you, and it was a pretty good show. So you guys, anytime you want to go back and check those out, go back. Feel free to do that. That's why they're out there. Anything I could do to help you, send me a message. I finally got one of our listeners, Lewis, if you're listening in Waco, hey, I finally got your stuff sent to you about that recode from Dale Bredesen. Got it sent off to you today, so you can check your email. If you get something from the rockhealth@protonmail.com, that's my email that I send when I'm communicating with people about important stuff, the rockhealth@protonmail.com, and you can so you look in your email for that. You should have got a document today that is recode. Anybody that wants it, it's all the breakdown. It's the in-depth. It's like 17 pages, I think, that's there, and it's the in-depth stuff of the recode. You can also go by the book, right? The End of Alzheimer's by Dale Bredesen. But yeah, it's just my notes. So what I said I would do if you wanted them, I said I'd send them to you. I'd just send you my notes, and that's what I did. And so we just scanned them, and that's what I do when I'm breaking down books. I'll just get me a yellow pad and a pencil or a pen, and as I'm going through the book, then I'm just breaking it down. I'm just taking notes on it and trying to get as much from it as I can. It's kind of funny. I was thinking about it last night because yesterday I had a great opportunity to get together with some of the former football players here in Lubbock that played football at Texas Tech. The Double T Varsity Club put on a lunch for us, and we got to listen to Coach McGuire. He came over. I got to meet our head football coach at Texas Tech, and my daughter's involved in that whole thing, so she makes sure that I get invited to those things and get to be a part of them now. So It's a lot of fun. Got to see some really good guys. Got to meet some of the guys that I didn't know that played before me, and some of the guys that played after me. And so it was really good to get to see those guys, and then listen to Coach McGuire talk about the upcoming season and what's going on with the football team and all that. And it really was a good thing for me because it was great to be around some competitive people. And, these guys compete at a really high level, whether or not you're a sports fan or not, or whether you even understand athletics or not. A lot of people don't. And so we tend to say negative things about things that we don't understand, right? That's just typical human nature. But there's a lot of stuff going on in athletics that those guys are trying really hard to win games against people who are trying really hard to win games. And it brings out the most competitive spirit in men and women together. But in football, in men, it brings out that competitive spirit. So, those guys are competing from a nutrition standpoint. They're competing from a sleep standpoint. They're competing from a exercise, powerlifting standpoint. And hang on. And so it's pretty cool to see all those guys get together out there and compete. So it was fun to be around them, and it actually kind of kept me up a little bit last night because I guess I was just fired up about that whole experience, and so I went out. I was up at 2:00 in the morning just thinking about a lot of that stuff, and looking at these notes, and I was thinking about how I learned in my 7 years of college athletics at Texas Tech and 3 more years at New Mexico State. So I guess it was 10, 11. It was 11 years total. I know there was some there's tricky math right there, but I remembered an extra year. But I was in college for 5 years, 1 year at Eastern New Mexico, 4 years at Texas Tech, and then coached for 6 years. So that's 11 years of college football that I was with. And I was thinking about it last night when I was awake about how kind of what I do now is break down and attack some of these things the same way I did when I was coaching. And that's kind of what I do with the book review stuff. I look at the books and I look at them the same way, and then I end up with my notes and stuff. And there's 16 pages just on the Bredesen protocol that I had. So if you guys want it, I'd be glad to send it to you. I'm not copyrighting the book or anything. I'm just sending you my personal notes of it, and if you're interested in it, I'll send it to you. And if not, I really highly recommend that you read the book. It's Ending Alzheimer's and Reversing Alzheimer's, and we've talked about it lots on the show. And so that's something that's out there. I came across an article this morning, and if you guys don't know who Dr. Mark Hyman is, he's a really cool dude. Like, I don't know him personally, but I've followed him for quite some time now. I've got some of his books in my office. I've listened to lots of videos of him talking, and I opened up my phone this morning, looked at Instagram, and he's who I follow on Instagram, and that's what. And so he had his post. This you can go to this DrMarkHyman, Dr. Mark Hyman, on Instagram, and got a lot of great stuff. But he's talking about one of our favorite subjects, and that's omega-3 fatty acids. And he says, we've seen a lot of research on the benefits of omega-3s for cardiovascular benefits, but new research is showing much more. And here he goes, and he's on PubMed, and this is an article on PubMed. It says, one recent meta-analysis of 40 randomized controlled trials found that high doses of EPA and DHA outperform existing pharmacological interventions in prophylactically treating migraines, with the greatest decrease in migraine frequency and severity. So there's an article here that says EPA and DHA can address migraines, right? Here's another one right here. Another study found that taking omega-3 fatty acids was associated with a significant increase in serum levels of brain-derived neurotropic factor, BNDF, compared to a placebo group. BDNF, he had that wrong, actually. BDNF is a protein in the brain that nerves and is a protein in the brain that preserves nerve cells and encourages the growth of new ones, and it plays an important role in learning, memory, and behavior. Additional research found that omega-3 supplementation, as well as separate vitamin D supplementation, reduced the risk of autoimmune disease. In this study, participants took the omega-3s for 5 years, but the risk reduction was prevalent even 2 years after supplementation was discontinued. So, and then he goes on and says, hey, if you're curious about what I'm reading, listening to, watching, and trying, check out my Mark's Picks newsletter, and then he'll send you a newsletter with that too, if you're interested in that stuff. So Dr. Mark Hyman brings us a lot of stuff. Really appreciate his work, appreciate his effort. But one of the things you get when you read this, it's like, okay, here's autoimmune diseases. Here is the growth of nerve cells. Here's another one that talks about migraines and cardiovascular benefits. Why? Because healthy people inhibit, and healthy people don't get Alzheimer's disease, and healthy people don't get cardiovascular disease, and healthy people don't get these things, right? You just have to understand the definition of health. You just have to understand what exactly, how are you defining health, right? If you say to yourself, well, that health is the absence of symptoms, and then they get Alzheimer's disease, you're like, oh, well, they were perfectly healthy and then they got Alzheimer's disease. No, it's not true. Something was going functionally wrong somewhere along the way. We just don't have a very good way of describing health, but we know that it decreases inflammation, right? Omega-3 fatty acids decrease inflammation. They give us a chance to heal the cell. They give us a chance to protect the mitochondria. And that's really what's going on. That's why it works in so many different areas. Omega-3 fatty acids are super important. Dr. Hyman's got a bunch of stuff. You could go on his, he's just got lots of stuff, lots of diet stuff, really super great guy. You can learn a lot from him. And while I was just thinking about it while I'm at it, and it's just like, how many people am I following? And what are those things that some of the guys that I'm following? Dr. Josh Matson, never met him. He's a chiropractor. Love the guy. He's a fellow of International Board of Functional Neurology, and he focuses on pediatrics and primitive reflexes. And he does great. I'd love to meet him someday. Lots of stuff, lots of kids. If you want to know about chiropractic and kids, he's a great one to go to his page. It's Dr. Josh Madsen, Madsen. You can see him on Instagram as well. And great stuff. I mean, like, really good, brilliant guy. Takes care of lots of kiddos. Does a great job. There's another guy here in town that does a great job with kiddos too. His name's Tracy Wilson at Global Health Chiropractic. If you ever get a chance, to look at some of Tracy's stuff too, he's been one of the top chiropractors in America for lots of years. And he's right here in Lubbock, Texas. And so he does a lot of that, a lot of good stuff with kids as well. I listened to a guy named Wallach Warriors, spreading the good word. He's a veterinarian, I believe, but he has some pretty good stuff. I like to listen to White Oak Pastures, WHITE, White Oak Pastures. 157-year-old family farm in Bluffton, Georgia, and they bring it to you. The guy's pretty straightforward with the way that he describes things, but it's regenerative farming with his cattle and grass-fed animals, and doesn't use chemicals and all that stuff on his pastures. It's really good. Insulin-resistant one, Justin Richards, glucose monitor and supplements. Fantastic guy right there, Justin Richards. Insulin resistant, RESISTANT, and then the number 1. That's another one that I follow. Go through there and tell you all of them. Here is tikka, Tikka, tikka masala. I don't know what that is. You guys might know what kind of food that is. And my blood sugar. Real sourdough in my blood sugar. Fake sourdough in my blood sugar. Sourdough bread in my blood sugar. Avocado toast, butter popcorn, salsa, whole food meal, Celsius energy drinks, and my blood sugar. Just goes through a bunch of stuff. Like that guy. Just like to see it. Just like to show you what's going on. Of course, Jordan Peterson and Mark Hyman and Dr. Huberman. Those are some of those main guys that I like to listen to from a health and wellness standpoint. Right there, good stuff. Good guys. If you don't know him, Andrew Huberman. If you don't know him, got tons of great stuff. Super popular guy, guy from Stanford. We talk about him a lot. Those of you guys who listen to the show, y'all know him. Y'all know what I'm talking about when I talk about Dr. Huberman. So um, those are just some of the guys that I follow on Instagram. Try to get as much information from them as I can, and I'll look here and see. Like, I don't even know on X some of the guys from a health and wellness standpoint. Most of them, Judy Mikovits. Judy Mikovits has taught me a lot, and I think it's super important. Jordan Peterson again, and that's pretty much it. So most of it's mostly Instagram stuff that I get. Um, and I had a conversation with somebody not too long ago, and they talked about, well, I just don't spend much time on TikTok, so I don't like to. I don't get much of that. I'm not interested in much of that health and wellness stuff from social media. Well, I get that, but I don't do anything on TikTok either. The um, but some of the smartest guys in the world are using social media platforms to help share information about health and wellness. You got to kind of sift through them a little bit to see which ones they are, but some of them are out there and they're sharing that stuff on a daily basis, and so you can learn a lot of stuff with social media. Everybody knows that with YouTube, right? But we could do that. So wanted to go through some articles tonight. Wanted to talk about some different things, just do some research. I love research. And I don't know if I brought this one to you or not. If I did, it's early on in the show, but I want to make sure that we do this because you may have never heard of this before at all. But this comes from Surgical Neurology International, July 16th, 2010, Volume 1, number 31. So it's the name of the article is Type 2 Diabetes Mellitus and a Central Nervous System Etiology. So over a period of 43 years, these authors have studied arterial pulsatile vascular compression of the cranial nerves. They have demonstrated that a number of hyperactive dysfunction syndromes were not only caused by vascular compression, blood vessel compression, but that they could be relieved without loss of function by mobilizing the offending blood vessels or vessels away from the nerve. Microvascular decompression, what is called MVD. In the prospective study, the authors hypothesized that decompressing the right vagus nerve and medulla will result in better glycemic control in patients with type 2 diabetes. The arteries commonly involved in the vertebral artery and the posterior inferior cerebral artery. So those are arteries running right through the middle of your neck, right? And that vagus nerve is coming off that brain, that between your skull and C1, you're getting that vagus nerve coming through there, and that whole area, that upper cervical region right there, and the vagus nerve. Remember, that's the one that runs pretty much all of your organ system. It's about 85. They say about 85% sensory, so your organ system are feeding through your vagus nerve, and then it's also interesting that these guys use the right one, right? So in this prospective study, the authors hypothesized that decompressing the right vagus nerve and medulla will result in a better glycemic control in patients, better sugar control with the right vagus nerve. Well, what do we get when we have hyperactivity of the right hemisphere? Right? We get exhaustion of the right upper brain, which leads to escape of the lower brain, escape firing the amygdala on the lower side, and then the vagus nerve gets involved on the right side. And now the vagus nerve gets involved, and we start to have disruption in digestion, immune system, and reproduction and posture, right? And so this is what this article is all about right here. An MRI arterial compression grading was performed preoperatively and postoperatively. Let's see, the patients underwent retromastoid craniectomy with microvascular decompression for type 2 diabetes mellitus. Now, dude, you got to have some, it's got to be bad. I don't even know how to say all those words. Really, 10 patients underwent retromastoid craniectomy. Now, if I break that down, your mastoid bone is right here. You could tap on it right up underneath your ear. That's your mastoid bone. Craniectomy means getting rid of your cranium, which we're going to remove that. With microvascular decompression, we're going to take those small blood vessels and decompress them for type 2 diabetes. Is that crazy? We're going to do brain surgery for type 2 diabetes. Their ages ranges from 43 to 63. The duration of the diabetes ranged from 1 to 20 years. Patients were assessed preoperative at 3 months, at 6 months, and at 12 months. Patients were instructed to make no changes in diet or exercise during the study period. Plasma glucose levels were measured. Serum insulin levels were measured. Hemoglobin A1C levels was measured. Patients were followed for 12 months with glucose monitoring studies of glycemic control, pancreas function, and insulin metabolism. Dr. Murphy says it's now accepted the international neurosurgical community that vascular compression causes cranial nerve hyperactive syndrome, including trigeminal neuralgia, vertigo, disequilibrium, glossopharyngeal neuralgia, hemiphase spasms, Meniere's disease, and spasmodic torticollis, where you get stuck on your neck. In 1973, first observations were made on the essential hypertension, which proved to be vascular compression syndrome on the left anterior lateral medulla. I know this sounds a little crazy, but I just wanted to give you the fundamentals of the whole thing, right? 86% of the patients with hypertension, high blood pressure, could be improved or relieved of their hypertension by microvascular decompression of the left lateral medulla. Half of the patients were able to discontinue antihypertensives, blood pressure meds, and in the other half, the medication doses would decrease significantly. On this basis, it became reasonable to assume that there should be a right lateral medullary syndrome. We do that every single day, all day long. Adjust the cervical spine, the occiput. I don't know how many occipits I've adjusted this week. Almost all of them. Like, check the occiput, adjust the occiput, check the cervical spine, adjust the cervical spine, take the pressure off of that stuff, do the brain exercises, release the muscles on the front of the neck, get the posture to return to normal, bring the head back where it's supposed to, take the pressure off of all that stuff without doing any sort of surgery, right? The pancreas is partly innervated by the right vagus nerve by means of the hepatic and celiac branches. It may be affected by increased activity in the right vagal brainstem nuclei. A preliminary retrospective study showed that all patients with type 2 diabetes had arterial compression of the right anterior lateral medulla. You mean to tell me if you're subluxated, you know that word we've been talking about since the beginning of this show, 6 months ago, now we're in our 7th. The very first night we talked about subluxation. Subluxation means interference in your nervous system, pressure and dysfunction on your nervous system, right? So we check and detect for subluxation. Subluxations are caused from physical, chemical, and mental emotional stress. The combination of those three things can put your body in a state that puts pressure on your nervous system. And when that happens, a preliminary retrospective study showed that all patients with type 2 diabetes had arterial compression of the right anterior lateral medulla. Metabolic syndrome, insulin resistance, and type 2 diabetes were all related to neural loop feedback dysfunction. How many times has anyone ever told you that before? How many times has anyone ever talked to you about the idea that neural loop feedback dysfunction, neural is nerve, feedback, there's a loop feedback dysfunction that's going on between the body and the brain and the body, their loop that's going back and forth. and dysfunction. It's just the same thing as a subluxation, right? It's interference in the proper nerve pattern firing of the nervous system. Insulin resistance, um, hyperinsulinemia, is said to be the single event and causal in the development of type 2 diabetes mellitus. These authors disagree. Pulsatile arterial compression of the right anterior lateral medulla oblongata is associated with autonomic dysfunction, including driving the pancreas, which increases insulin resistance, causing type 2 diabetes. That's their take on it. That's why they say that's super important. Let me read that for you again. Pulsatile arterial compression of the right anterior lateral medulla oblongata is associated with the autonomic dysfunction, your autonomic nervous system, your fight or flight, your parasympathetic and your sympathetic nervous system, including driving the pancreas, which increases insulin resistance, causing type 2 diabetes. That's an important factor in this article right here. So, being subluxated, possibly, not according to me, according to the, what I say this was, Surgical Neurology International, July 16th, 2010. These are the guys that said, hey, look, you got compression on those nerves, you can end up with type 2 diabetes because your pancreas is getting driven by your autonomic nervous system. Hey, you guys stick around. We'll be right back right after these messages, and you're listening to Life with Jason Clemmons, DC. You know, I know it sounds crazy, but it's not. It's not that crazy. It's pretty straightforward right there, right? 7 of the 10 patients who received microvascular decompression for type 2 diabetes mellitus showed significant improvement in their glucose control. This was noted by a measure of diabetes markers and decrease of diabetes medication dosage. One patient was completely off diabetic medication. The 3 patients who did not improve in their glucose control were the only subjects that had obese body mass index. Arterial compression of the right anterior lateral medulla appears to be a factor in the etiology of type 2 diabetes mellitus. So, of the most significant is this finding that the normal course of disease progression has slowed in the majority of the participants. The reduction of diabetes medicine is also significant because the decrease of the side effects associated with these medications that the patients may have to deal with. It is important to note that these improvements were seen while subjects made no behavioral changes, no weight change, no change in diet or exercise activity levels, nothing. Body mass index appeared to be an important factor in the outcome of this study. Those who had the best outcomes from intervention were overweight, while those who did not respond were obese. So we got some metabolic factors going on right there, right? That make it even more difficult for those people to control their diabetes. But there's the subluxation pattern in that person driving them. That was one of my first questions that I had this morning was, tell me about heart rate variability and what does that mean? And it's the measurement of the change of the variation between your heartbeats based on your autonomic nervous system, your fight or flight or your rest and recover, your sympathetic or your parasympathetic nervous system. Hang on one second. All right, everybody, we're back. This is Life with Jason Clemmons, DC. It's Thursday, March the 7th. We're talking about some research tonight, and we're talking about diabetes being that somewhat related to, in certain circumstances, can be related to a subluxation or interference in the nervous system, an overactivation of the autonomic nervous system, and the autonomic nervous system being the balance between the parasympathetic and sympathetic nervous systems, your fight or flight control, or your rest and recover control, right? The implications are made with some surety that a number of problems of aging are due to arterial compression of the brainstem, specifically the medulla oblongata. It appears to us that one does not inherit hypertension. I'm going to say that again. It appears to us that one does not inherit hypertension. One does not inherit diabetes. Rather, one inherits blood vessels, veins, and especially arteries, We inherit the size, the location, the proclivity of deterioration, and the elongation of arteries. We may possibly inherit the sensitivity of our myelin to pulsating vascular compression. Type 2 diabetes mellitus is associated with arterial pulsatile compression of the right anterior medulla oblongata, which appears to be an important etiological factor. Microvascular decompression may be an effective treatment for non-obese type 2 diabetes patients. Microvascular decompression, and so the same thing as a subluxation. So you could just basically say, to a certain extent, that a chiropractic adjustment, you could substitute where it says microvascular decompression, you could substitute a chiropractic adjustment, maybe an effective treatment for non-obese type 2 diabetes. That's not what the article says. That's what I'm saying to you. Because when you're subluxated and your brain's firing wrong, and you've got hyperflexion in your hypertonic flexor muscles, and you change the angle of your cervical curve, you can put micro compression on the arteries. We've got that in our book. I don't have it with me right here on the show, but we did go over it. Remember, every new patient that comes into our office that gets a notebook, at the back of the notebook talks about vascular changes, blood supply changes to the brain when you lose the cervical curve. It changes the brain when you lose the cervical curve. I didn't make that up. It's just science, right? So I think that's a big deal, right? How about this one? This study was funded by Blue Cross Blue Shield of Western Pennsylvania. This is a study on compressive neuropathology. The compressed nerve is the vagus nerve, and at its origin in the anterior lateral medulla, the compression is caused by either vertebral artery or the posterior inferior cerebral artery. These authors have discussed noting that the vagus nerve is unique in that its efferent fibers, meaning going from the brain to the body, function asymmetrically, meaning that they're different on the right side and the left side, claiming that it is the only cranial nerve to do so. The left vagus nerve controls the heart, and compression causes essential hypertension on the left side. The right vagus nerve controls the pancreas and glycemic control. You could have an increased amount of blood pressure because you're subluxated. And it's like, come on. It's not the only reason, right? So when you're a chiropractor and you're taking care of patients, your job is to not treat the symptom. That's not what we do in our office. I'm not treating the symptom. I'm treating the cause, if the cause is the subluxation. And as I've learned over the last 20 years, which, I've 24 years actually, because this is my anniversary sometime this month, 24 years ago, I learned what a subluxation was. And subluxation means interference in your nervous system. And where does the interference come from? It comes from physical, chemical, or mental emotional stress. I had a little girl today. She's probably 12 years old, maybe 12, 13 years old. She played soccer all weekend in Dallas last weekend. She's a goalie. She's playing against a team that took a lot of shots on goal, and she's doing a bunch of diving. And the diving created a muscle spasm in the quadratus lumborum muscle on her right side, which is a little muscle that goes over the top of your hip. It's a little short, thick muscle that goes over the top of your hip bone and connects to your bottom rib and then across into your lumbar spine. And so multiple dives, over and over again, and she ended up with a spasm of that QL and some sort of dysfunction. What do we talk about? About sensory information, right? Sensory information is nervous system information, right? Remember when we talked about, it was either last night or the night before, when we talked about muscle memory and muscle memory not being a thing, really? There's some fascia. I get it. There's some fascial adhesions. There's some different things there. I'm not saying that there's not some multiple factors, which I think there is, but you're talking about neurofeedback in a loop and neuroplasticity right there. So the same thing I'm talking about here is this whole physical stress from this little girl playing soccer. Physical stress caused the interference in her nervous system. Chemical stress, if you don't believe me, just drink a lot of alcohol and just keep drinking a lot of alcohol until you get interference in your nervous system. Eat sugar all the time until you get interference in your nervous system. Breathe some sort of chemical and see how it affects your nervous. If you get a headache, breathe diesel fumes and see if you get a headache. Don't kill yourself. Don't go like that. I'm just saying, you ever been around like you breathed a bunch of diesel smoke or something like that, and then you got a headache. Headache means ache, means feeling, means nervous system, right? So chemical stress can cause interference in the nervous system, and then mental emotional stress. Just get really stressed out about something. Get really, really stressed out. Go through a horrible experience in your life. Lose a loved one, get divorced, whatever the thing is, right? Go through something that's horrible like that and see if you don't have some symptomatology show up. You will, right? So the left vagus nerve controls the heart. If you're subluxated and you got pressure on that nerve and you've got pressure on that brainstem and your occipit's not right and your C1's not right and C2's not right or your cervical curve's not right or your frontal lobe's not firing properly, you might have high blood pressure. And then let me ask you a question. If that's the case, if that's the reason you have high blood pressure, how does a high blood pressure medication stop that thing from happening? It doesn't. It doesn't change it. That's why people say when I get off my blood pressure medication, my blood pressure goes back up. And it's like, oh, so your blood pressure medication did not solve your problem. Your blood pressure medication simply masked the symptom of the problem that you had, right? So anyway, great article right there. And then Dr. Murphy's always great because he actually gives us a breakdown right there. He'll write it out for us neurologically and go through the whole thing. The nucleus tractus solitarius and how it's a sensory nucleus of the vagus nerve, and how the dorsal motor nucleus vagus is the motor nucleus of the vagus nerve, and then the vertebral artery and the posterior cerebral artery, and then how all that stuff fires together in your brain, and then what a subluxation does to you right there. So enough about that. That was a great article. Another one I wanted to get to was magnesium. I wanted to talk about magnesium for a little while, and we've talked about it in the past. Just thought I'd go over it again. Magnesium is super important, but there's some things that you might want to understand about magnesium and some of the things that affect magnesium. So factors that reduce one's magnesium level. Here's some things that might take away from your magnesium levels. Nutritional inflation. Industrial farming techniques began poisoning the soil with pesticides, herbicides, and nitrogen fertilizer. The soil became lifeless. Plants grown, and this is from the Magnesium Miracle, Carol Dean, MD, Ballantine Books, 2014. Plants grown in devitalized, overworked soil that has been poisoned by acid rain are more in nutrients, including magnesium, are poor in nutrients. If the food you are eating is not grown in soil replenished with minerals, the food will automatically be mineral deficient. That's a big point right there. Look, if we can't talk amongst ourselves as human beings without getting offended, I'm not talking about farmers. The country folk that I know, the rural America is the backbone of America. The rural America is some of the greatest people I know. They're good folks. I love them to death. And I'm not throwing any shade at them, right? I live in West Texas. This is a rural place of the world. I'm not throwing shade. I'm not talking trash about you whatsoever, right? I'm just saying that, look, could this be true? Could it be true that if you're eating food grown on soil, if the food you're eating is not grown on soil replenished with minerals, the food will automatically be mineral deficient. That was what we were talking about last night with supplements. If we're eating food that's mineral deficient and we're trying to build proteins, and we're trying to build hormones, and we're trying to protect nerve cells, and we're trying to do all those things that go on with proper function in the body. We need an entire the whole package of the supplements, right? We need to supplement. We need the things that are in these bottles to make sure that we have to put the minerals back in that might be gone. Levels of all minerals have been diminished because farmers don't use mineral fertilizers, and because many of the chemicals used as herbicides and pesticides bind up minerals, especially magnesium. The mineral depletion of our farmland is probably the most important reason why most Americans are magnesium deficient. You can only obtain about 1/3 of your mineral needs from good organic food. So the diet, 500 milligrams a day a generation ago versus 500 milligrams a day versus 200 milligrams now. This is written in 2014. Increased carbohydrate consumption. Sucrose, sugar, depletes 84 magnesium molecules. Glucose depletes 28 magnesium molecules. Fructose depletes 56 magnesium molecules. Chronic stress increases urine excretion of magnesium. Statin drugs increase magnesium excretion. These drugs all deplete magnesium. NSAIDs, diuretics, antibiotics, antacids, proton pump inhibitors, birth control pills, fluoride compounds, herbicides on crops, mercury amalgams, vaccinations, fish that have a lot of mercury, significantly increase magnesium kidney excretion. You're getting rid of magnesium. Alcohol blocks magnesium absorption. Phosphorus in sodas, diet and non-diet, deplete magnesium. Smoking, aging reduces magnesium absorption. So we increase our magnesium, and magnesium helps the ATP pump, and that helps take glutamate and aspartame out of circulation and helps store it in the astrocyte, a cell in the brain, right? Corn and soy increase arachidonic acid, which increases prostaglandin E2, which leads to free radicals, which ends up with Parkinson's and CTE and Alzheimer's, right? Calcium pumps. Your calcium increase, lots of levels of calcium increases free radicals and other non-hormetic toxins. So just a little something right there. Magnesium blocks the NMDA, which is neural brain receptor. Magnesium blocks that calcium from turning into a free radical. That's what I wanted you to know. Free radicals are those little damaging little molecules that cause all kinds of havoc in our body, right? It's just super important that we get that. And one of the things that's super cool right here is I actually wrote down, and these are some of my notes from quite a while back, but I wrote down right here, cold lasers. This ramps up and it will push the GLUT ASP into the astrocyte and will store it. So that's where the glutamate and the aspartame that's what one of the things that cold lasers do. And I'm excited to have that in my notes because we just got a cold laser in the office. Been wanting one for quite some time and just got it this week, a red violet cold laser. And so I'm kind of excited about getting that into production here at the Rock Health and Wellness Center. Tomorrow I'm supposed to get, I mentioned this to you. Tomorrow we've got our brain mapping equipment that should be delivered. I'm super excited about that because when you're searching for the subluxation and you're trying to figure out where the person has interference in the nervous system, you can reverse engineer it. I can take the symptoms from the bottom up and I can say, okay, this is going to tell me which part of the brain's not firing, or the right side, the left side, the cerebellum, the cortex, whatever is going on in the brain. But now I've got some technology where we can actually put the cap on you. I think it's got 19 different leads. We can put the cap on you. We can do a quantitative EEG and get a brain map. And the brain map actually is going to tell us which parts of the brain are hyperactive and which parts of the brain are hypoactive, meaning they're not very active, and which parts of the brain are functioning normally, which gives me just more information to determine which part of your nervous system is not firing properly. So I'm super excited about that. There's lots of things that we can do with that information. There's lots of the neurofeedback for me is not going to be from a psychology standpoint. The neurofeedback is going to be from a strictly chiropractic standpoint of what we're going to do in the office. We're going to be able to detect which parts of your brain are not firing properly, and then we're going to get to be able to address those in our complete package of things that we do in the office, not just with what we do in the brain center and with the vibe plates and the laser glasses and all the things that we do in the brain center, but also to be able to do some real-time treatment and activation and monitoring of the brain while we're doing the treatment. It's going to be fantastic for kids. It's going to be fantastic for trauma patients. It's going to be fantastic for people who want to maximize life. When you use it from a wellness standpoint, you're not just treating the symptoms of someone who's symptomatic, but I'm super excited to see what it's going to do for us, give us an opportunity to like maximize what's going on with our health. We can take 70-year-olds and make them way better and rock. And I've got one. She listens to the show all the time. I'm not going to call her out, but we did some body composition this morning when she came to work out, and she did a Tabata workout. If you guys understand, if you guys do any HIIT workouts, Tabata is 8 rounds of 20 seconds as hard as you can go, and then 10 seconds of rest. So it's 4 minutes of work total, but it's 20 seconds on, 10 seconds off. So before this 76-year-old woman came and did her Tabata workout that we did this morning, she did body composition, and her body composition is fabulous. And I know what her omega-6-3 ratio is, and it's fabulous. And I was just thinking about her when I was looking at the results of it. I was like, she's rocking it. I mean, she's on the go, she's on the move, she's doing all those things. She's rocking it, and I'm super proud of her for the effort that she's put into it and the way that she's rocking. She'll be rocking it in 10 years. She'll be rocking it in 20 years. I don't have any doubt 20 years from now, 96 years old, she'll be rocking it too. And I hope she's still right here at the office. 20 years from now, I'll be 73 years old, and I plan on rocking it just as good as she is. That's my plan anyway. So just thought it would be cool. Just thought it'd be cool to talk about. Take your magnesium. Make sure you do that. People say, how much should I take? I usually take what's on the bottle, but I always dose magnesium. I let your bowels dose it. When you absorb enough magnesium into your body, you're going to get loose stools, and it's going to loosen things up. If you've got constipation and your bowels aren't moving, that's something where you could really, really understand. Hey, take your magnesium, take more of it, take more of it, take more of it, take more of it, until you get things loosened up to where they will move. It's super important for you right there. Another thing I want to talk about tonight is just some of these nutrients. When you're talking about the nutrients, where are they found? If you didn't want to do supplements, where would these nutrients be found in nature, right? So I got a list right here. Vitamin E. So what does it do? It's an antioxidant. It regulates oxidation reactions, stabilizes cell membranes, immune function, protects against cardiovascular disease, cataracts, macular degeneration. Where do you find vitamin E? Where is it found? Wheat germ, liver, eggs, nuts, seeds, cold pressed vegetable oils, which we're not really like olive oil. Okay, that's fine. Avocado oil, that's fine. Dark leafy greens, sweet potatoes, avocados, and asparagus. That's place for vitamin E. Calcium, very common. Bones, teeth, helps heart, nerves, muscles, body system working properly. Needs other nutrients to function. Can't just, really don't think we should be over calciuming ourselves, but dairy, wheat, soy, flour, molasses, brewer's yeast, Brazil nuts, broccoli, cabbage, dark green leafy greens, hazelnuts, oysters, sardines, and canned salmon. Now, just because it comes from dairy, wheat, soy, flour, doesn't mean that's on our list of things to eat. We can substitute. We can look in the dark, the leafy greens, the hazelnuts, the Brazil nuts, the broccoli, the cabbage, those other things, and get that just as well. Chromium assists insulin function, increases fertility, carbohydrate fat metabolism, essential for fetal growth and development. Supplementation, brewer's yeast, whole grains, seafood, green beans, broccoli, prunes, nuts, potatoes, and meat. Some of those same things. Here's magnesium. Where does it? 300 biochemical. Sorry. What does it use? What does it do? 300 biochemical reactions, muscle nerve function, heart rhythm, immune system, strong bones, regulates calcium, copper, zinc, potassium, and vitamin D. Where do you get it? Green vegetables, beans, peas, nuts, seeds, whole unprocessed grains. If you're going to have the grains. Yes, that's just one of the things. Zinc, where do you get it? Oysters, red meat, poultry, beans, nuts, seafood, whole grains, fortified breakfast cereals, which we don't eat, and dairy, which we don't eat much of either, right? CoQ10, oily fish, organ meats, whole grains. N-acetylcysteine, that's one of mine that I take. Glutathione, what does it do? Glutathione production, lowers homocysteine, lipoprotein A, heals lungs, inflammation, decrease muscle fatigue, liver detoxification, immune system function. Meats, ricotta, cottage, cheese, yogurt, wheat germ, granola, and oat flakes. But you're going to get it from there. That's N-acetylcysteine and glutathione. See what else? B vitamins, 1, 2, 3, 6, 12. Here's all these B vitamins right here. Lots and lots of function with B vitamins. Carb conversion, breaks down fats and proteins, digestion, nervous system, skin, hair, eyes, mouth, liver, immune. Pork, organ meats, whole grains, and enriched cereals, brown rice, wheat germ, bran, brewer's yeast, blackstrap molasses. Same thing, right? Mushrooms, soy, dairy, eggs, green vegetables, beets, meat, poultry, organs, meats, fish, and nuts and seeds. So if you eat your meat and vegetables, you eat your nuts and berries, you eat a little bit of fruit and no sugar, you're going to get your most of it right there. And I was going to get into some discussion about oxalates tonight, but I think we've talked about that, and I'm not going to. Vitamin C. Supplementation, broccoli, Brussels sprouts, cantaloupe, cauliflower, citrus, guava, kiwi, papaya, parsley, peas, potatoes, peppers, rose hips, strawberries, and tomatoes. Vitamin D, sunlight, milk, egg yolk, liver, fish, where you could get those things where they're found. Vitamin K, very important, kale, green tea, turnip greens, spinach, broccoli, lettuce, cabbage, beef liver, asparagus, watercress, cheese, oats, peas, and whole wheat. Vitamin K is super important if you're taking a lot of vitamin D, and if you're taking much of it, it'll all come together right there. So, that's a lot of stuff. Like that was just like full speed right there for an entire hour. So, hope you guys enjoyed that. I hope you guys will come back and hang out with us tomorrow night. We'll be here live again from 6 to 7 tomorrow night on Friday. If you have any questions, send us a text, send us a comment. But love to help you guys out. I enjoy doing this. It's lots of fun. It keeps me competitive. It keeps me going. And I'm really hoping to get better at it as we go through this. So you guys have a fantastic evening. We will see you tomorrow night at 6 on Life with Jason Clemmons, DC.